guys. Sorry, I'm in a recovery pod we have at the clinic, so it's looks a little different than I normally am. I got temporarily kicked out of my treatment room for the next 20 minutes. But here I am. Hope everybody's doing well. And yeah, so my name's Ed. I host these things every Tuesday, so I can answer any questions regarding blood flow restriction training or rehab or anything else that you may have for me. If you have any questions, just go to the chat section. I want to say hello. Hey, Abe, what's up? Hello from Dallas, Texas. If you want to put in there where you're from, it's good for me to know kind of where everybody's at. All right, well, while I'm letting everybody get settled in, yeah, we had a good conference this last weekend. National Strength and Conditioning Association did our presentation on what we saw with a 4-week microcycle, meaning 4 weeks of training with blood flow restriction training in conjunction with high intensity training. So we did a couple days a week high intensity training, which is defined of 65 to 90% 1 rep max. So your normal heavy load training, which you would expect with Division I football players, which is what our subjects were. And then we had BFR 2 days a week. And what we were looking for was, does it increase 1 rep max and squat in trained individuals? And it did, which was pretty amazing. we had one individual who increased their squat by 20%. So very cool. So it looks like that using BFR in conjunction is helpful, reduces loads, so guys aren't as likely to get hurt, and decreases the amount of stress on the central nervous system, and so that means that your recovery time is going to be faster. So some cool things. I met some people there that I've never met before. Dr. Schoenfeld, who writes on muscular hypertrophy, I met him. That was awesome. And got to connect with some of my friends in the field, which was very cool. Keith, Friendswood. My brother's from Friendswood. He lives in Clear Lake, and he has a rehab and manual therapy facility and teaches at the massage school down there. And I used to have a bike shop in Friendswood, so very cool to have you here. Thanks for being on. Lewis asks, question for today: if a set at medium pressure is somewhat fatiguing on the first 30 reps, but light for the subsequent series of 15 reps, is it okay to up the weight somewhat for the 15 rep set? Yeah, absolutely. So you can always modify these weights on the fly. There's no problem with that. Just because you start with a weight at 30 reps, what I'll do is I'll just keep bumping them up, because in all honesty, I don't know what somebody's 1 rep max is in rehab. Tissue's injured, we're not really sure. So what I'll tend to do is start with a weight that I think they're going to be able to do 30 fairly easily. If they do their second 15 and there's no fatigue at all, you should start to feel a little fatigue at about rep 10 of the 15 on the second set. I'll bump the weight up a little bit. I don't mess with the pressures too much. I let the pressures be, but I will bump up the resistance. I want them to get to as close to failure as possible. And in fact, I think that the reason some people don't get results with BFR is it's not because the pressures aren't high enough. It's because they're not using enough load in order to stress their system and get close to fatigue. So absolutely, Lewis, bump up your weight a little bit. You won't probably need a lot. You probably just need a 2.5 or a 5 pound difference. And that should get you to closer to volitional failure. Thanks for the question. A great question. The study that we're designing, that we're going to look for hopefully grant status with the NFL on ACL recovery and rehab, we're trying to write in the programming where we don't use a set amount of weight. What we do is we go till the clinician thinks that you're going to either get close to failure or just about to failure, like a 1 rep or 2 reps to failure. And so we're trying to figure out how to be very stringent with our science, yet have some flexibility for what is real life, like in the clinic. And that's really why I like doing these things. I like to find out what works in the clinic and then study it. A lot of people like to do it the opposite way. What works in the lab, can we apply that to real life? So I kind of do it the opposite way. Like, what do I think is going to work? What does work with my patients? The N is, my cases are small in the clinic. So then I say, well, can we study that to see if that is that actually what I'm seeing, or is it placebo or whatever? Not that I don't think placebo is effective. I do think it's effective. I think it's great, actually. But we also want to know, try to push the science whenever we can so we can make better recommendations. All right. Any other questions for me today?
What are they doing here?
Abe, I noticed that bars don't recede during use, so I recharge every day. I also noticed that the pressure is about 15 points less than the hand pump. By working out every morning, I have been able to increase my reps and loads. I do hit fatigue every workout. Doing it every day significantly reduces my recovery time. Awesome. Okay, good. So you're getting good battery life usage. That was one of the problems that we were having. Was one of the delays was that the battery was getting overused. And so I'm glad that you're experiencing that. It's not really reducing down. That's good. We never want to get below 25% on our units of battery life, because it will automatically shut down, so you can't find the occlusion pressure. It's a safety mechanism. So try to keep your units plugged in when you're not using them. It won't hurt the battery to keep it plugged in. It doesn't overcharge it or anything like that. It's better to keep it charged and full than it is to let it go too low. So that's awesome. Oh, the battery failed without warning. Interesting. Was that, oh, so the bars were normal and then all of a sudden it just shut down and you had to recharge it? And Lewis, of course, yeah, that's no problem. Yeah, the book is getting finalized at the editor. I haven't heard back yet, so I know they were supposed to be out by the end of last month. Hopefully I will get that back ASAP. I'll send a note to my editor today and find out if I can get an update. But hopefully it will be back soon so we can get those printed and out. Deflated on its own. What I would do is plug it in every 2 or 3 days. Shouldn't happen. But if you're not getting a good reading on that battery life, connect with Smart Tools, and we may have to replace that.
You can use your word.
Okay. Yeah, it will go to a certain level and deflate. Okay, yeah. So if that continues to occur, then let's get it back to HQ and let's get a new unit out to you. For anybody that wants to pre-order my book, it's at bfruniversity.com. That's where I post all these afterwards now, and any other information I will post on that site. Lewis, do you recommend the 30-15-15-15 over the 45-15-15-15 in the literature? Well, it depends on what literature you're looking at. There's most in the last few years have been kind of sticking to this 30-15-15-15. I think 45 is too high. It's too many reps. I mean, now we're looking at 90 reps to get to close to failure. I mean, it's too much. It takes too long. It's too boring. So I would say the weight at 30 should be enough to get you pretty fatigued. If you can do a full 45 reps on that first set, the weight's too light. It's not enough. So bump up the weight a little bit so that way you can do 30, but you're not going to do very more than 30. You might get to 32, but that's going to be about it. Don't be afraid to use a little bit of Yeah, do you know who the author was? It Sentner with the meta-analysis. I mean, there's uh, the consensus now is 30 reps is enough. I mean, there's got to be a practicality to this, just like I was mentioning to you. Is like for me to take somebody through 90 reps, it's already people are like, oh my god, this is 75 reps is a lot. To go to 90 is just like, So I do think increasing the load. If people can do 30 reps, it's good. Yeah, Centner. Yeah, for some reason, I don't recall the 30 reps, but I mean 45. But ultimately, it's your body doesn't know if it's 45 reps, 30 reps, 15 reps. All it knows is it's getting tired. So the 30 reps is a good way to know that the weight is light enough. Um, we don't want people only being able to do 8 reps because then you're going to be closer to your 70% 1 rep max. Um, so it doesn't have to be exact. I would bump up the weight though, Lewis. I mean, you're going to be better off putting the muscle under tension than not putting the muscle under tension, unless there's some reason that you can't. And if the weight's if 30 reps, if the weight at 30 reps is too heavy for the tissue, you may want to think about just going to isometrics or altering the programming. But other than that, I would keep to the heavier. Yeah, for sure. There's so many papers. Keeping it straight is difficult for sure. Doug asks, is a Jacksonville State study that you recently reviewed available online anywhere? I think I shared it. Did I share it a few weeks back when I interviewed those guys? If I know that it hasn't been published fully yet because it's in the Strength and Conditioning Journal. It was, I think, pre-released for e-publication. We just presented on it last week, so it should be coming out fairly shortly. I do have a copy though, and so what I'll do is I'll have to see when. I think it's on the BFR University. I'll put a link to it I got to get permission from NSCA before I do that. So let me just make sure on that because it'll get published here pretty shortly. Let's see. And have you ever used BFR to heal a small tendon tear? If so, what was the protocol? I'm having an issue with the audio, but we'll try to access answers on your site. Oh, really? Anybody else having audio issues? Okay, so small tendon tears, I do the same protocol. I do 30, 15, 15, 15. 30-second rest in between sets, and then take a 1-minute rest, and then go to a next exercise. I will probably do that for 2 weeks, and then I will look at if I need to. I typically don't need to, but I will go to eccentric loading as heavy as possible. So sometimes I will transition out of BFR and then go to heavy eccentric loading. In those cases, if I don't want to cause any damage to the tissue, or I'm afraid of causing damage to the tissue, I'll use the ischemic preconditioning protocol, which is 100% limb occlusion pressure, 5 minutes on, 3 minutes off, times 5 rounds prior to the heavy eccentric loading, which helps to reduce damage to tissue. So we know know that you break down tissue more with eccentric loading, especially when it's heavy. So pain levels to get above like I have a combination. Sorry, guys. I don't know what happened. Let's see. So where you want to be careful, Abe, is at terminal extension, so you're not irritating the tissue. Just like we're in the early phases of ACL rehab, we tend to avoid end range, or end range extension at least. So what I would do is keep the weight low on your open chain exercises and do the end range loading as long as you don't feel any pain with it, but keep no weight on the ankle and just do long arc quadriceps. Just like basically we would know that as like a leg extension, but with no weight. So you're just doing it off the edge of the table and doing full contraction. I wouldn't over squeeze at the top, but what you can do instead is, if I'm doing this here, so I'm doing that full extension. Place your hand on the inside of the leg and just kind of keep patting it, putting pressure on it to get that vastus medialis oblique to contract, and make sure that thing is firing. And you should be okay with that. That shouldn't load that meniscus in that open chain. Of course, if you get pain during it, or if you get any swelling after the exercise, then you are irritating the meniscus. So then you want to back off of it. Does level 2 BFR course get into programming alterations? In my opinion, what to avoid is probably more informative than how to specifically adjust program because of individual differences. I'm not sure what you mean. What I wasn't planning on. I'm not sure what you mean. What do you mean, Louis, as far as what to avoid? Like overtraining, like those types of things? Or my plan and what I have programmed for level 2 is really how to use BFR as an adjunct to normal traditional training, protocols for cardiovascular fitness using cycling and biking, running and sprinting. I review the literature on augmented BFR training with athletes, like that type of thing. And if there's anything specifically that you want to see, let me know. Kinds of programming changes that might result in overtraining, injury, and effectiveness. Okay, yeah, got it. No, but I think it would be good to kind of throw that in there. You know, it's really hard to overtrain with BFR because you're using the light loads. The central nervous system doesn't really get fatigued. And so you're not going to, it's just really hard to do. I mean, you'd have to really purposely be doing a lot of training in order to overtrain, especially if you're keeping to the 3 to 5 sets or 3 to 5 exercises per body region on a training session. Let me think about that, and I could possibly throw some stuff in for sure. All right, well, I'm at 20 minutes. Gonna finish up my lunch here and get back to patient care, but I appreciate questions today. Um, and thank you so much for joining me. If you're not subscribed to my YouTube channel, please do so just by clicking that subscribe and hit the bell next to it so you get notified when we update on a weekly basis. All right. Thanks so much. See you next week. Bye for now. Soft tissue work, strength training, exercise.